Hello, I'm Dr. Jay Anderson, and my presentation today is diabetes and oral health. I am the dental director at One Community Health in Sacramento, California. Diabetes in African Americans. In 2018, non-Hispanic blacks were twice as likely as non-Hispanic whites to die from diabetes. African American adults are 60% more likely than non-Hispanic white adults to be diagnosed with diabetes by a physician. In 2017, non-Hispanic blacks were 3.2 times more likely to be diagnosed with end-stage renal disease as compared to non-Hispanic whites. In 2017, non-Hispanic blacks were 2.3 times more likely to be hospitalized for lower limb amputations as compared to non-whites. All these results are devastating to African American families who live with or have experienced diabetes. There are several risk factors related to diabetes. Some of these risk factors are obesity and being overweight, hypertension, high cholesterol, cigarette smoking. All these things are lifestyle issues that can be regulated by an individual. These are a list of common mouth problems that occur with diabetes. The number one problem is gingivitis. It is an unhealthy or an inflamed redness in the gums. How do we treat that? Daily brushing and flossing, regular visits to the dentist, cleaning, I use Listerine Total Care personally, and the use of a water pick. Periodontitis is a more advanced gum disease. It can change from mild to severe. It is particularly invasive in diabetic patients. The symptoms would be red, swollen, bleeding gums, gums that are pulled away from the teeth, long-lasting infection, bad breath that doesn't go away, permanent teeth that become loose or move away from each other, changes in the way your teeth fit together, sometimes pus between your teeth. It also impacts how your dentures and partials may fit. Treatment for periodontitis would be deep cleaning at your dentist, medicine that your dentist prescribes, gum surgery in severe cases. Also, management of your diabetes is very important. Another problem is called thrush or candidiasis. This is a growth of a naturally occurring fungus that occurs in your body that your body is unable to control. In your mouth, you get white, sore, and sometimes red patches on your gums, tongue, cheek, or at the roof of your mouth. Patches that have turned into open sores. How do we treat this? We treat this with medicine that the dentist or your physician prescribes to kill the fungus. Cleaning your dentures, removing your dentures at night and soaking them in medicine that your dentist prescribes. Also using a moisturizer if you are missing teeth and you take medications that cause dry mouth. Dry mouth, sometimes called xerostomia, is a lack of saliva in your mouth or a lack of the quality of saliva in your mouth that raises your risk for tooth decay and gum disease. The symptoms would be a dry feeling in your mouth often or all the time, dry, rough tongue, pain in the mouth, cracked lips, mouth sores or infections, problems chewing, eating, swallowing, or talking. The treatment is to take medicine that keeps your mouth moist and that your physician or your dentist prescribes. Rinsing with a fluoride mouth rinse to prevent cavities. Using sugarless gum or mints to increase saliva flow. Taking frequent sips of water. Avoiding tobacco, caffeine, and alcoholic beverages. Using a humidifier, a device that raises the level of moisture in your home at night. And again, avoiding spicy or salty foods that may cause pain in a dry mouth. Other problems, burning mouth or tongue. A burning sensation in your mouth is caused by uncontrolled blood glucose levels. The symptoms would be a burning feeling in your mouth, a dry mouth, bitter taste. Symptoms may worsen throughout the day. Seeing your doctor may change your diabetes medications. Once your blood glucose is under control, the oral burning will go away. You may also experience sores or ulcers that do not heal, pain in the mouth, face, or jaw, loose teeth, pain when chewing, bad breath that doesn't go away. And of course, we want you to see your dentist at least twice a year if you suspect you have diabetes or you're under treatment for diabetes. Planning a dental visit. You may be taking diabetes medication that can cause low blood glucose called hypoglycemia. If you take insulin or other diabetes medication, take them as you usually would before visiting the dentist. I've had many patients who don't take their medication prior to coming in, and we have to delay treatment or even reschedule them for their appointment. You may need to bring your diabetes medication and your snacks with you to the dentist's office. We may need to postpone any non-emergency dental work if your blood glucose is not under control. If you feel nervous about visiting the dentist, tell your dentist and staff about your feelings. Your dentist can adapt the treatment to your needs. Don't let your nerves stop you from having regular dental checkups. Waiting too long to take care of your mouth may make things worse. Smoking and diabetes is a dangerous mix. Smoking raises your risk for many diabetic problems. Smoking problems makes your mouth problems worse. Smoking raises your chances of getting gum disease, oral and throat cancers, oral fungal infections. Smoking also discolors your teeth and makes your breath smell bad. 6 ways to reduce your risk of diabetes. Number 1, get screened. Plan an annual visit to your physician's office. Simple tests can help diagnose type 2 diabetes. Hemoglobin A1C and fasting glucose are common tests. Some dental offices are ordering these tests in coordination with primary care providers. Start a healthy diet too. Diabetes Guide to Foods for African Heritage is a great resource. Many Black Americans, healthy eating is synonymous with bland and boring diet. Diabetes care and education specialists can play a role in helping avoid high or low carb diets. Number 3, lose weight. Moderate weight loss of 7% of your current weight can reduce the risk of diabetes. Number 4, get regular exercise and increase physical activity. This may be walking 15 to 30 minutes every day at an even pace. Number 5, reduce stress. Consider meditation or other means to reduce stress during your daily life. I personally take an hour and just listen to jazz. that helps reduce my stress. Dental cleaning. Number 6. If you've been diagnosed with periodontal disease, some studies have indicated that deep cleaning can reduce your hemoglobin A1C by 1 point. That is significant in helping you reach your goal of maintaining a healthy hemoglobin A1C. Improving diabetes can improve your oral health, and improving your oral health can improve diabetes. Stressing the importance of oral health is important. The American Dental Association states treating gum disease can help improve blood sugar management in those living with diabetes, decreasing the progression of the disease. Regular dental visits are important. Research suggests that treating gum disease can help improve blood sugar control in patients living with diabetes, decreasing the progression of the disease. Practicing good oral hygiene and having professional deep cleaning by your dentist can help lower your hemoglobin A1C. Thank you very much. These are references that are available that help me put together this presentation.